Touro University is the fastest growing medical school in the western United States, and here to explain how Touro University is growing and also helping better fulfill the healthcare needs of members of our community is CEO Shelly Berkeley. Hello, Shelly.
Hello, Melissa. How are you?
I'm good, thank you very much. Now, really impressive background with you. You're a former congresswoman, and I understand you know the ins and outs of the Affordable Care Act. So tell us, what are some challenges we face here in California?
Well, I think you hit on it in the introduction. The Affordable Care Act envisioned that we would be providing affordable and accessible access to health care for 30 million more Americans. The only thing is that we did not, on the other side of the ledger, add the necessary funding to create the residency programs that doctors need in order to practice medicine. When you graduate from medical school, and at Touro University we are graduating 135 future doctors every single year. But you're not a doctor when you graduate medical school. You still have 3 years of residency. The challenge we have is not enough residency programs. Federal government capped the number of residency programs that are available. Consequently, growth states like California are going to have a serious doctor shortage because there's not enough residency programs for the students that are graduating from medical school in California to stay in California to actually practice.
Wow.
Interesting statistic, 69% of physicians end up practicing in the state that they do their residency program.
Really?
If California doesn't have enough residency programs, even though they have a serious physician shortage, we are actually educating healthcare providers to go practice medicine in another state
Somewhere
where they're
else.
doing their residency programs instead of in California where we have the greatest need.
Yeah, and then also too, I imagine with more people having access to affordable health care then that also will probably escalate the need for physicians. And we're already faced with that potential of having those physician shortage because of, you had mentioned, the residency issue. So how do we address this issue then?
Well, the biggest challenge we have is in primary care physicians. 68% of the students that graduate Touro Medical School go into primary care. These are the very type of physicians that California needs more than any other. And so what we're encouraging, a number of things. We're graduating the students. They are ready. They want to go into primary care. They believe in serving underserved populations and being a part of the community that takes care of people that have medical challenges. What do? We graduate them. We're going to be working very hard to make sure, or to help, that the federal government lifts the caps and provides the necessary funding, and it comes through Medicare, to actually fund the graduate medical education. We're also going to be encouraging the California State Legislature to create a fund that will pay for residency programs, which are graduate medical education. Now, after the program is up and running, it pays for itself because the hospitals can bill Medicare and they'll make money with the residents that they have. The only thing is, starting the programs are challenging because they're expensive. So that's the direction. California has one of the greatest needs in the country. Why? Because we have an aging population. We're going to have far more people accessing the healthcare system that ever did before. But we're also, especially California, has the oldest physician population in the country.
Really?
So as physicians are retiring, we're not graduating enough, and there aren't enough residency programs to fill their shoes. We also have a changing demographic, and most English-speaking white doctors, while so important, my husband is one of those, the fact of the matter is we have a more diverse demographic population here in California. We have 1,400 students. It's not only a medical school, and we're graduating 135 future doctors every single year. We have an outstanding school of pharmacy. We have a remarkable nursing program, physician assistance program.
Healthcare. You want to check out this
related.
university.
Absolutely.
Excellent. Thank you so much.
Thank you
really
very much, and happy holidays.
Hey, you too.